at the Tualatin location of ROC Orthopedics, right off I-5. Today we are talking to an orthopedic surgeon who specializes in the treatment of knee injuries. We are with Dr. Elliott Cole at ROC. Dr. Cole, thanks so much for having us.
Of course, thanks for being here.
As an orthopedic surgeon, you see a lot of ACL tears. What exactly is an ACL tear and how do you go about treating it?
So an ACL is one of the main stabilizing ligaments in the knee. Mainly it helps with front back knee stability, but it also is important in rotational stability of the knee. So for any athlete or any person doing sports or activities that involve cutting, pivoting, stabilizing, very important to have a functioning ACL.
Okay, what about meniscus injuries? How do you go about treating those?
It depends kind of what type of meniscus tear it is, age of the patient, quality of the meniscus tissue. Sometimes it's non-operative with things like injections and bracing and physical therapy. Sometimes we debride or just kind of trim the torn part of the meniscus. And sometimes we repair it completely, just kind of depends what type of tear it is.
And prior to this interview, you were giving some patients injections. How does that work?
The point of the injections is to help with the symptoms, knee pain kind of in the area of the tear or swelling. And sometimes something like a cortisone or steroid injection is very helpful to eliminate that pain and kind of get the swelling down.
And let's talk rotator cuffs. You see a lot of rotator cuff injuries. How do you treat those?
Again, it's very patient specific. It kind of depends on whether it's an acute tear after a certain injury or if it's more of a chronic tear, kind of wear and tear over time. It can be similarly things that are non-operative like steroid injections and physical therapy to help with the pain symptoms to a rotator cuff repair to kind of tack that torn tissue back down.
What's the most rewarding part of being an orthopedic surgeon here at ROC?
Besides the guys here who are awesome, as a sports doctor, the most rewarding part for me would be seeing an athlete on the field who gets hurt, being able to diagnose their injury, do their surgery, follow them through the recovery process, and then get back out on the field.
And sometimes you have patients return to the field as even better athletes than they were before.
That's the goal, obviously. It takes a lot of rehab to get there, but a lot of times in that rehab process, getting the other muscles stronger, working on coordination, helps you get back out there faster.
Dr. Cole, thank you so much.
Of course.
To learn more about orthopedic care and recovery at Regenerative Orthopedic Center, visit rocpdx.com.